warmly introduce tonight's speaker, Janet Press, RDH. Janet is a fellow of the Academy of Laser Dentistry and is the most highly sought after international speaker and trainer in soft tissue laser dental education. I can validate that. Janet holds standard proficiency in both Diode and ND YAG lasers and has over 30 years in hygiene practice, which means she started at about 10 years old. She's got 22 years of laser clinical experience. And what we're most excited about is working with her around some of her certification programs, which I know we're going to talk a little bit at the end. But she provides comprehensive hands-on clinical education, is a go-to expert when it comes to lasers in dentistry, particularly with the hygiene community. And it's my pleasure to warmly welcome tonight's speaker, Janet Press.
Wow, thank you, David. I really appreciate that. And it's my pleasure to be here with everybody tonight. And thank you, BioLace, for your generosity of education for us hygienists. We can't thank you enough, for sure. So I'll go ahead and get started. And those of you that might know me, I do talk very quickly, and it has nothing to do with being nervous. It's just I'm a fast talker. I'm also a fast walker because I'm short and everybody in my family was tall. So I have to really try to keep up with my voice and my movements. So bear with me if I talk too fast. I think you'll find out you're going to get a lot of information. So I really want to start out with that science has shown the way forward. Both the healthcare profession and the patient population recognize many health conditions originate in the oral cavity and can exacerbate other medical conditions. You know, this COVID has changed all of our worlds, and I really want to talk about this a little bit before we get started and how this makes it so important for us to make changes in the way we practice. But our patients, more now than ever, know they've connected the dots. You know, we've been talking to them about the oral systemic connection, and we've been giving them all kinds of information. But now that they've been home since March and we've been under all these circumstances, what they really know now is that bacteria and viruses are bad news, and that infections create inflammation in their body, which make them more vulnerable to becoming infected with a virus that could ultimately take your life. So the public is very, very poised for us dental professionals to open the conversation back up where we left off and bring the COVID conversation back and play with them. So we want to remember that the jeopardy of the patient's physical health is what is really controlling everybody's world right now. And the present model and definition of patient education has shifted in dentistry. It's one that educates the patient on the medical risk of having periodontal infection and its direct effect on their immune system. So we want to keep that in play throughout my program today, because having said, David saying to you that I've been using lasers for, well, it's been 26 years that I started using lasers. And I can tell you that I've stuck around for the good stuff, because right now, with everything that's looming in front of us and behind us and around us, there couldn't be a better time than ever to make the change and jump into using a laser. It has to do with the medical risks on our patients, periodontal infection, and it's a direct effect on our immune system. So according to an article published online July 30th, 2020, the Journal of the California Dental Association, and by the way, if you don't know this, the California Dental Association is actually the largest dental association in the world. There's more dentists in California and hygienists in California than just in California alone than all of the rest of the United States. So this is a really great group to kind of keep an eye on what's coming out of their journals and things like that. I would really suggest it. So patients with inflammation caused by periodontitis may experience more severe COVID complications. Mounting inflammation supports the cytokine storm and the inflammatory effects of COVID-19, which continues to challenge our profession to reevaluate today's model of care. So we're really sitting right here in the middle of this, because we've been talking about the inflammatory cascade with periodontal infection and how it affects other systemic biodirectional diseases. So this is just playing right into it. The association tied to bacterial load, the researchers explored complications of COVID-19 seen among those with poor oral health and periodontal disease. Well, they actually looked at the population that was succumbing in the early days of COVID, that was succumbing, and they knew that the comorbidities were really clear. But then there was about 50% of that population that did succumb that did not have the comorbidities of diabetes, heart disease, and obesity. So when they really took a look closer, they found that the oral microbiome, or the microbial flora of the mouth, was explored, and its connection with the COVID-19 outcome was analyzed. So their statement was, we recognize the connection between high bacterial load in the mouth and post-viral complications, and how improving oral health may reduce the risk of complications from COVID-19. You and I are not the only ones that are getting this information. You know, the public, my neighbors are coming over and asking me that they're reading online about their oral health and the connection with this virus, and they want to know if they can get in sooner than later, right? So the public is being as informed almost as much as we are. So according to an article published, oops, sorry. You know what, I'm sorry, I'm pressing the wrong button. Bear with me for a second. There we go. Previously, studies have shown that laser periodontal treatment can lower overall systemic inflammatory markers. I've been talking about this, you've been learning about this, you've been talking about this for a long time. So the question would be, if systemic inflammation can be lowered with laser periodontal therapeutic treatment, can this type of oral care now also play a role in decreasing host susceptibility to COVID-19? So this is what I want you to be keeping in your mind as we go through what we're going to be doing with the lasers. So can dental treatment decrease the likelihood of developing these superinfections? Controlled studies are undergoing presently to examine these common inflammatory and pathogenic pathways between perio and COVID-19. So keep your ears and eyes wide open for this. But I look at this as a direct call to action for the expansion of our hygiene philosophy. You know, there's a lot of things happening with our profession in and of itself. I don't know if you're aware of some of this, but there's all kinds of new graduate programs with the nurse practitioners, as well as the physician's assistants, that they can go on for another 2 years and actually have a certification. It's actually a degree program after they've finished their physician's assistant program, as well as their hygiene, their nursing RN programs, that they go on for another 2 years. And the new programs are being called dental risk assessment. So they become a conspirator, so to speak, with the dental population by diagnosing and treatment planning patients in the medical offices and sending them to the dental office. This is a huge change for us. So these circumstances have created a unique opportunity for us hygienists, and now is the perfect opportunity to increase our value in the entire healthcare profession. And I think you probably know this about your neighbors, or people you maybe haven't talked to in a while, or showing up at your doorstep asking you questions about their health. So the COVID-19 discussion of comorbidity and severity is right up there with oral health. So I say bring it on. We have the education and we have the capability of being responsible for risk assessment with our patients and moving forward with therapeutic models of treatment to stop the inflammatory cascade. So we need to get serious about laser technology-based methods and implementation. And so that was the invitation for me to be involved with all of you tonight, was to kind of clear up some of the confusion that's occurring with the nomenclature, the words that are being bantered about laser. There seems to be some confusion about when to use it, what you're supposed to be doing when you use it, and that sort of thing. So I'm going to try to get into that with you today. So it's the healing benefit of lasers through the reduction of inflammation and disinfection and the elimination of bleeding that speaks to the true value of laser implementation. So our purpose behind it is, first and foremost, is to reduce inflammation, because we know that it affects all other parts of the body. And we know that disinfection is what occurs when you use a laser, and the elimination of bleeding is what also occurs. It's because we eliminate the infection, the bleeding stops, the inflammation goes away, and the patient becomes healthy. And this plays right into the new American Academy of Periodontology classification system in the standards of elimination of the biofilm-induced infections. So the standard of care for the integration of a diode laser in dental hygiene is for the purpose of disinfection. So I want everybody that's listening in tonight, and I think that there's some of my Canadian friends joining in with us, so I send you my love, because I haven't been up there in a while and I miss all of you. But I just wanted to give a shout out. But it doesn't matter where we live and where we're practicing. The bottom line is the standard of care in dental hygiene laser is disinfection. Okay, and then there's some other different variables that can occur based on where you live and where your scope of duties are in your scope of practice. The laser bacterial reduction, commonly referred to as LBR. Now, this is what you're going to hear a lot about, is this acronym LBR. Okay, so keep that in mind, is the treatment standard for laser assisted hygiene, where emission of standardized low energy settings and a bare uninitiated fiber optic is the #1 treatment model performed by dental hygienists for patient care in the US and Canada. Okay, then having said that, keep that in mind that that's the #1 standard that we're going to ascribe to. But there are some differences state to state and within some of the different provinces as well. So what is the treatment called and what are we doing? I had the most unbelievable privilege to actually lecture with Dr. Terry Myers, who really was responsible for the first laser that was built for dentistry. And he and his brother built our first dental lasers and got the first, FDA clearances back in the early 90s. And so I was very happy to know Dr. Myers. He passed away this last year, not from COVID, but it breaks my heart because we owe a debt of gratitude to him. And I just, I don't know if you've seen the article, myself and Valerie Dangler, you guys probably all know her. We just wrote 2 articles, 2 different sequence article with RDH Under One Roof. One was published in August and the other one was in November. So take a look. But so I shouted out as a memoriam to Dr. Myers. But in his original manuscript, and which I actually have, Dr. Myers said, okay, so now we've got this laser. So what would a hygienist use this laser for? And the answer was, well, we've been doing periodontal therapy. Always, we've been doing SRPs. So wouldn't it make common sense that we would use the laser to assist us in periodontal therapy? So that's where the acronym LAPT that you hear all the time originated in Dr. Myers' original manuscript. So then what would the hygienist do? Because what would the laser do when we use it? Okay, so what would we actually accomplish? And that is laser bacterial reduction, disinfection, LBR. So that was the original description for those acronyms. Now, fast forward to today, and I lecture a lot, and I'm a speaker in a lot of places, and people come up to me, and I started recognizing that people were using these acronyms differently than Dr. Myers' original intention. But the way I was hearing about it, it made a lot of common sense for inter-office communication. So what I did is I contacted Dr. Myers and I spoke to him about it to get his opinion. And he clarified with me that he believed that the way everybody was using it sure made a lot of sense. And that it has to do with inter-office communication. And it's how we are able to differentiate what we're doing in the back. So if your patient is scheduled for your SRP appointments, you're going to be using your laser-assisted periodontal therapy. You're going to be using your laser. So your front desk, the people that are collecting the money and doing all the insurance, they know that when that patient is scheduled for quadrant, sextants, SRP 4341, that they know that you're going to be using the laser. And so most offices are putting an icon into the computer that you click on LAPT and it differentiates and lets the front desk know when they're checking the patient out that laser has been used during periodontal therapy. And then what happens is that what about all the other ways we're using the laser? Okay, so we're finding out that the inter-office communication needed to change because we have our patients coming in recall. They've been through laser-assisted periodontal therapy. They're in recall every 3 and 4 months. And so we're using the laser maybe on risk management recall, and we'll talk more about that. So how do I let my front desk know that I'm going to use the laser on them? They're not in therapy any longer. They're in recall. Maybe they're even healthy, and I want to use the laser to keep them healthy. So a way to communicate to the front desk would be able to have an icon on your computer that allows you to click into LBR. So it was appropriated today to that patient that you asked them if they'd like to have you use the laser on them for disinfection. They said yes. So they know that there's going to be an additional charge along with their prophylaxis or along with their 4910 periodontal maintenance appointment. And so that's communicated to the front that what you did with them today was the LBR, which in fact, when you use the laser for LAPT during during your recall, your patient's recall, you're disinfecting and also with your patients in root planing and scaling. So that gets a little confusing, but I want you to keep that in mind that that's become an inter-office communication standard, and I think it works really well so that we can make sure that our patients are billed at the front or charged at the front for the things that we've actually done for them in the back. So the objective of laser-assisted periodontal therapy is commonly known as LAPT, is to leave a clean coagulated wound to heal. We know that the periodontal infection creates a wound, and that our objective is to clean the wound and to heal the wound. So the laser is used as an adjunct during traditional periodontal therapy, our Ssrp appointments, for the therapeutic treatment of the periodontal infections. So keep in mind that LAPT is equal to therapeutic treatment, where we're trying to eliminate infection, active infection in a patient, be it gingivitis or stage 1, 2, 3, 4 periodontitis, or even peri-implantitis, okay? So laser bacterial reduction is commonly known as LBR, is the bactericidal effect or the result that you achieve when you're using the laser at any given moment, whether it's in your LAPT appointments or whether it's in your risk management recall, that the result is always going to be LBR, laser bacterial reduction. So keep that in mind. So the universal standards of wound care and the objective of modern periodontics is ultrasonics and hand instrumentation used to debride the existing wound, and then laser is used to disinfect the debrided wound. So that's how you want to be looking at this when you're using your laser in the generic sense of our traditional ways of practicing. But there's been some things with the COVID that have kind of shifted how we might be thinking of treating our patients when they sit down in our chairs. So the objective of using lasers in the hygiene is to eliminate pathogens via antibacterial reduction, destroy viral pathogens, and promote healing through the anti-inflammatory effect. With the introduction of COVID-19 and the importance of aerosol management in our operatories, and I know all of us are experiencing this, LBR has become increasingly of interest to reduce risk as a pre-procedural modality to diminish the circular, bacterial, and viral environment of negative pathogens. Okay, so what I want you to remember about pre-procedural modality is that we're not using it therapeutically. Yes, it's disinfecting. It's 1,000,000 to 1 bactericidal. So congratulations. But we haven't used it in the same way that we would use the laser for a diagnosed patients with gingivitis or any of the stages of periodontitis. This is strictly for using your laser as a service to your patients. And I think it's a practice builder that, here we've got all this going on, and we've got to remember that the patients are coming to us because they trust us and they respect us, and they're concerned about their oral health and their physical health. So we need to remember that we can tell them all these things that are new and different in what we're trying to do, but are we going to treat them the same way as we've always treated them? Their expectation, there's been surveys that showing that the patient's expectations is that because of all of this, we've got newer and better ways to treat them. So this is where the laser comes in. Whether you're using it already, you need to expand what you're doing with it, or if you don't have a laser, now there's never been a better time than to get one. And they're affordable. Hygienists are buying them for themselves, okay? So I wanted to show you this because we want to look at the value of the laser. Laser produces, it's a thermal event, it produces heat, and its effect on this virus, where there's a lot of information. And believe me, with me being homebound pretty much, what I've been doing is really digging deep into the research at the national level with the National Institutes of Health, the World Health Organization, and on the medical side, I'm linked up with the medical side with all their webinars and stuff. So what I want you to see is this actually is the COVID virus itself, and heat does have a direct effect on this virus. Let you take a look. Even though this slide is talking about using drugs to break down and stop the cells the virus from entering into the cells. I'm using this picture because it really is a beautiful slide showing you this lipid membrane that is encapsulating, that you hear them talking about this envelope on this virus, which makes it so protected. Well, this lipid membrane is what our laser can have a direct effect on. And let me show you. Heat is thought to affect the coronavirus in part because it is an envelope virus with this lipid layer. Research on other envelope viruses suggests that this oily coat makes the virus more susceptible to heat. So I like to cook. So I kind of like to think that I'm using my laser and the sulcus for pre-procedural disinfection. So we had our patients, do their pre-procedural rinse and gargle, and then we're going to put them in the chair and as a new way of giving them safety and ourselves safety with ourselves and the environment, offering them this pre-procedural use of the laser for circular disinfection so that when we go to treat them. So laser bacterial reduction, LBR, along with pre-procedural rinse, will allow the clinician, that's us, to confidently decontaminate and reduce cross-contamination in the mouth prior to other dental and hygiene-related procedures. The laser can be used as a first line of defense in our preventive approach to patient care. 25 years ago, when I started using lasers, we actually did this, but we got away from it because time is of essence and things like this. But I do want you to be thinking about this, because I can tell you I'm tracking this with my clients, and those of them that are doing this with their patients and saying, you know what, we have the laser, or if they're not aware that you do, or we do have a laser. And so out of health and safety, with everything that's going on, you've rinsed your mouth, you've gargled, now I'm going to use a laser very quickly. It's a little light, I'm going to shine it around your gums, and that's going to disinfect your mouth on a certain level also, that while I'm working on you, it doesn't spread the germs anywhere. It's going to keep those germs down. In the public, I can tell you, they're walking out of the dental practice and letting every one of their friends know that that's what you're doing. My dental office is doing this. So let's jump on that bandwagon for sure. So this is what laser bacterial reduction looks like. Just using the laser in the sulcus, it's a bare fiber, and we are going to go around every tooth, but it's not therapeutic, meaning that in therapy with the LAPT, we have a protocol of dosimetry. In other words, we use certain settings based on the diagnosis of the infection, the level of the infection. At the pre-procedural, we're using the laser for LBR, but we're going to go around the teeth relatively quickly. It probably is it's no more than 15 seconds a tooth. And just to give that quick disinfection with the lowest level of energy to disinfect, and then we can get started with what we're going to do. So changing the structure of your patient appointment by immediately addressing disinfection with a laser enables us hygienists to adopt a different approach. And so not only in the patient's newfound concerns about bacteria and viruses, lasers also open that door to communicate the importance of evaluating them now. Okay, I've pre-procedurally disinfected you, but I'm going to be doing an evaluation, further evaluation regarding treatment that might be necessary for biofilm-induced infection in your mouth. You've been under tremendous stress. We know that we've all, been on, our diets haven't been normal, our exercise hasn't been normal, the stress is crazy. So, which creates this inflammation that affects the rest of our bodies, putting our patients' bodies and putting their general health at risk. So I can see that this communication standard and this pre-procedural use of the laser is really so hugely valuable that I can't thank the people that built these lasers all the way back to Terry Myers for giving us the privilege of having these instruments to be able to sit right down and get to work with them and know that they're going to do the work we want them to do. So the laser is also an ideal instrument when specifically used during periodontal pocket therapy, LAPT, or laser assisted periodontal therapy. And I want to say periodontal pocket therapy sounds really good because it reminds us that we're using this LAPT acronym for therapeutic results. So due to the ability to destruct bacteria, help reduce inflammation, and for healing the periodontal wound. Whereas with pre-procedural, it's not therapeutic. It's not going to give the patient that has gingivitis or any stage of periodontitis a result in recovery, because we aren't using it at the settings that would be more appropriate for treating a patient therapeutically. So we want to be reminded that we're using the laser for healing the periodontal wound when used adjunctively during scaling and root planing. So the laser bacterial reduction LBR effect during LAPT is critical to the body's ability to limit its production of destructive chemical mediators and start forming its own capability to heal from the destruction caused by the biofilm-induced gingivitis, periodontitis, and implantitis. So once again, during LAPT, we're using the laser, and the outcome to using the laser is first and foremost disinfection. But then after that, it's the energy that stays into this and absorbs into the cell physiology because of the amount of energy and the length of time that we're staying, the dosimetry, okay? So power scalar debridement, and then during LAPT, LBR occurs in the sulcus when we use our laser. And what you should be seeing when you use your laser is a thin line of blood that coagulates at the cervical margin of the tip. And I'm not sure, because I don't really know how many of you in my audience, if I was sitting there looking at you, I'd be saying, so how many of you are using lasers already, and how many of you have never used the laser? Irregardless, this might be a review, but I think it plays into how we need to be really seriously thinking, and that our conversation needs to go directly to inflammation and infection and get started with conversations about treatment with our patients. So the laser virtually kickstarts the immune system's ability to heal while destroying bacteria that is present. You know, my brother was a theoretical analytical mathematician, quantum mechanics, quantum physics. I have no idea what he was talking about. He also was a card-carrying Mensa, which means that he's a genius. So it's very interesting to be raised in a family like that, but wow, what a credible brother he certainly was. So anyway, he talked to me originally when I was getting involved in lasers, because I was all crazy about lasers kill bacteria. But he said, Janet, wait till you figure out that the laser, the photonic energy, the light energy, how it heals through stimulation of fibroblastic and osteoblastic activity, that the resources that the energy travels into the mitochondria, the power supply of the cells, and how it can create true regeneration. So fast forward to today, and in fact, he was very, very accurate with those conversations that we had in the early days. And I'm happy to say that our dental model has moved into the regenerative capabilities of light energy. So we know that photons energize the body to heal through stimulation of the fibroblasts and the mitochondria, which have been negatively affected due to the presence of disease and infection. So it is these physiologic changes that actually in periodontal therapy becomes what our window of interest should be, that we're going to get the disinfection because that stops the infection, but we're going to see that the laser energy supports regeneration, and that we get these changes through laser biostimulation, initiating the body's own healing process. So laser implementation is utilized in periodontal pocket therapy as an adjunct to Ssrp with the expectation, this should be our clinical expectation with our patients, of a change in the microflora and gingival tissue wound healing. So that should be our expectation. No longer is it acceptable that our patients come back and they still have pockets that are bleeding, but it's better than it was. The new classification system demands that we eliminate the infection. So taking the mystery out of the laser, thank you, BioLase, for building this hygiene laser. And what I want to remind everybody, it's something you should take a look at. But what makes it special is that it's a non-surgical laser. So it's not a doctor laser. It's strictly designed for us hygienists, and it has pain relief applications, aphthous ulcer, herpetic lesions. It can do hemostasis, but it also has precise settings. The dosimetry that I was talking about earlier, or relating you to, that allows us to do point and shoot, because we're all in a hurry and we want to have things that work for us so that we can be very efficient with our patients. And with BioLase creating this laser, it gives us an instrument that we don't have to share with our doctors. It's not effective for the doctor to use. And it allows us to do the point and shoot based on the diagnosis of the patient, and we're able to use it for the things that we want to use it for. So go online, take a look at it, and it's affordable also. They've made it so hygiene, it's an affordable product for the doctor's office, the doctor to pay for it, but also for us hygienists to buy them for ourselves. So what is the objective of laser bacterial reduction? It's the laser protocol distinction for pre-procedural disinfection. So the intention is infection control and safety. So we want to build value with our patient experience during this COVID-19 world. The purpose is to destruct biocontaminants to mitigate aerosol contamination risk prior to performing scheduled treatment on the patient that same day. Okay. Outcome, laser bacterial reduction. And then technique, low energy settings, full mouth laser instrumentation, not intended for treatment. And in fact, the pre-procedural concept is not therapeutic in treating active periodontal infection, but you will get that 1,000,000-to-1 disinfection in the sulcus so that we're mitigating the aerosolization of bad things. So the expansion of laser hygiene. So let's think in terms of gingivitis therapy, stage 1, 2, periodontitis therapy, stage 3, stage 4, prophylaxis patients. Those are our healthy patients, risk management, recare, and medically compromised patients. And the new classification system does have an entire category of medically compromised health risks that are biodirectional with periodontal infection. So here's what we're looking at. The diode laser offered as a preventive service model. So we're going to make a distinction between preventive service, options for the patients that they pay additionally for, and then also our service where the patient's getting laser because they have an active infection. So keep that in mind. So we know that the bacteria, there's a suppression that can be up to 6 months. That doesn't mean that we see people less. It means that we can stay ahead of the curve of potentially having new infection. This is the bones of bone, Ciancio and Harristy. Also, Kosterson's work showed us the same outcome to treatment with our lasers. So option, LBR service for healthy recare patients. This is an additional service offered for your patients that are in 1-woman prophylaxis. It's an appointment when you're supporting support of maintaining a healthy patient and minimize the risk of gingivitis. You know, I started thinking about this. Why aren't we treating people that have no infection with a laser? Disinfection, we all have oral biomes. So why wouldn't we be using the laser on the lowest setting to use it prophylactically to keep them from getting this? So the outcome again is laser bacterial reduction, low energy settings, bare fibers, full mouth power instrumentation, followed by laser instrumentation. So you could use the laser at first and then do your power instrumentation, or the reverse, whichever you choose. So this is what it looks like. Once again, when we're using it in a healthy patient, you're going to get a little bit of bleed. We're not going to be using it for therapeutic reasons, so you're not going to see that collar of coagulated blood. So then LBR for risk management recare in medically compromised patients. Historically treated patients with periodontitis patients that are currently diagnosed healthy. So those are our 4910 appointments. Recent post-op Ssrp patients that with a current diagnosis of healthy. It's an additional service that you would offer your patient during their 4910 periodontal management recall to minimize their risk of new infection due to their periodontal history, which puts them at risk to get it again, and their medical compromises, which in most cases are biodirectional. So it's a proposed out-of-pocket fee, and I'm seeing anywhere from $35 to $50. I say keep the fee low. Your laser's sitting right there, use it, and offer this service to your patients. I haven't had anybody that said no because they've already been through therapy. They saw the laser, recovered them from their original diagnosis of having infection, and they want to keep it that way. And so using the laser on them routinely in what? Low energy settings, bare fiber, full mouth power instrumentation, followed by laser application. So real simple. It's just simply using it to disinfect them, and with this, to keep them healthy. And that plays into with the pre-procedural. So the diode laser is a diagnosed therapeutic treatment model. Now, once again, that's laser assisted periodontal therapy, LAPT. So laser therapy is used to stimulate the body's natural ability to heal. The effects of the laser energy include improved healing time, repair of damaged tissue, pain reduction. You know, the laser is, it depolarizes proprioceptor nerves, so while you're working on the patient, there's no discomfort. Increased circulation and decreased swelling. So by accelerating the healing process with increased circulation and enhanced tissue repair, laser therapy decreases inflammation throughout the body. So laser-assisted hygiene, why the good results? The laser soft tissue therapy affects a change in the bacterial load in the pocket. That's that 1,000,000 to 1 kill, and leaves a clean coagulated wound. Anti-inflammatory effect, and then photobiostimulation increases the fibroblastic and osteoblastic activity, increasing bone density. You'll see it on the radiographs, including possible regeneration of bone. I've never told somebody I'm going to grow their bone back, but when I start seeing it in the vertical defects, I certainly do show it to them radiographically. Promotion of healing the periodontal wound. So this is what it looks like post-therapy in your LAPT appointment. There's going to be a bleed around the cervical margin of the tooth, and it can be as thick and rich and red as you see on number 31, or on 30 you see sweaty blood, little sweaty blood spicules around the cervical margin, or on number 29, you can see there that it looks like a thin margin of bleed around the cervical margin. So it's not how much blood that you get, it's that the blood coagulates. So then here's the other option, LBR for gingivitis therapy. Once again, the patient has been diagnosed. So this is LAPT. They've been diagnosed with active periodontal infection called gingivitis. The treatment protocol has therapeutic value. If the objective is elimination of the infection. There's applied dosimetry. We're using a certain amount of energy and we're using a certain length of time to achieve a desired result. The code is going to be 4346, that's the gingivitis code. And then we've been using the 4999 code, which is the Perio code that people are using for LBR. And what that just does is it lets the insurance companies know that you're doing laser assisted therapy, or it is actually, it is about a periodontal therapeutic procedure, and that would be using your laser for LBR. So the outcome is, of course, disinfection. The treatment technique would be low energy, bare fiber, and then based on the patient's medical risk, would determine whether you do gingivitis therapy as a full mouth session or in 2 half mouth sessions. You would, of course, do power instrumentations followed by laser instrumentation. So this is, I love this picture. This is one of my patients that I've treated for gingivitis. And this is 3 months later after having treated her. And she's not getting laser today, even though that's a laser in the picture. You can see that I've taken a marking pen to color the fiber optics. So you can see it in my photo. But this is what healthy looks like. And us hygienists, you know, we've been living in a world of inflammation as long as we've been practicing. So here's what I want you to see. This should be your goal, that you see this level of healing. And it's remarkable to see this. I can barely put a 400 micron fiber optic up underneath her gum tissue because it's so healthy. So then we have our LBR periodontitis therapy stage 1, stage 2. A laser-assisted periodontal therapy during quadrant and sextant sessions. We're going to use the bare fiber optic again. We're using applied dosimetry. You know, that means energy and time. And the reason why I'm not giving you exact energy settings is because I don't know what lasers you actually have. And there are a lot of different laser brands out there. And one of the things about that is that all of them have laser energy settings, they have mode settings, and based on the wavelength of the laser that you're using determines what the actual energy setting would be and the amount of time that you would stay. So if you have questions about that, you know what? I'm here to support you. So at the end, I'm going to show you my phone number and my email. So get in touch with me. And if you're not sure, then I can certainly help you out with those settings. No problem at all. Or if you haven't taken a laser class, you can always take one from me and I teach you all that in my class. So regenerative healing is what we expect, elimination of the infection. Once again, the code is 4341 and 4999. So you're always going to use the 4999 code, and your front desk knows all about this, that this is a non-specific Perio code that we would use for laser LBR. So the fee, increase your Ssrp fee if you're in a fee-for-service practice, or charge out-of-pocket fees for your patients is what I find most offices. So this is what laser-assisted periodontal pocket therapy looks like. You're down in the sulcus, and as you move the laser around in the sulcus, you're going to find that you get this bleed that I'm showing you here. So at the end of treatment on this particular quadrant, you can see the bleed is what it's called. I've used the laser on every tooth. The infection in the mouth is not a per tooth problem. We've got to get away from thinking that the deepest pocket is the problem. No, the deepest pocket is the manifestation of the destruction caused by the infection that's in the whole mouth. So keep that in mind as we're learning about how we use our lasers. So then we have our option with LBR periodontitis therapy with stage 3 and stage 4. So that's our moderate, and you know, that's our patients that actually have 1, 2, 3, 4, 5, 6s, and then 1, 2, 3, 4, 5, 6s and greater. That's stage 3 and 4 in the new classification, which we in the past would have called it advanced periodontitis. So laser-assisted periodontal therapy, LAPT, during doing quadrant and sextant sessions. Initiated carbonized fiber optics. So that's different than when we're treating our patients with gingivitis, with our patients with stage 1 and 2, with our patients that are risk management recall, our patients that are just, we're doing, you know, pre-procedural laser disinfection. All of those procedures don't require that we initiate or carbonize the fiber optic. It's only when we move into periodontal debridement with epithelial and degranulation tissue removal, in other words, intentional curettage. So I highlight this because, once again, one of the first slides I showed you today was that laser standard of care in Canada and the United States is disinfection. That's most states don't allow hygienists to perform any form of curettage, whether it's with a Gracie curette or with a laser. So you need to know your duties in your scope of practice. The duties tell us what we can do, like, oh yeah, you can do curettage. Oh yes, you can do root planing. But what we want to know is that intentional curettage requires a carbonized fiber optic for tissue degranulation and tissue removal. So we have the applied dosimetry again, and energy and time is appropriated. Our expectation is regenerative healing. We're going to use the 4341 code. And once again, charge appropriately. Most likely it's an out-of-pocket fee with your patients, unless you can just incorporate it into your 4341. And so this, for those of you that don't know, the initiated fiber optic tip for curettage, you can use a cork. I love it. The BioLase laser does come with a little, it's like a metal cup that has a cork in it that just real convenient that you can use to carbonize the tip. And carbonization means that you're blackening the fiber optic by creating smoke, and that focuses the laser energy so that it's more efficient in its grabbing of the necrosis off of the epithelial lining and the granulation tissue in the furcations. So to get the efficiency in the later stages of periodontitis, where we really do need to remove that necrotic tissue. So biofilm induced periodontitis, this is my patient, and you can see here that I'm going to be treating this upper right quadrant today, but I love this picture because it shows you the healing that's occurring already in my patient that I've treated her lower right quadrant 2 weeks ago. And so what you're seeing here is my patient says, gee, look how you're growing my gums back around my teeth. And I say, what do you mean by that? And she says, well, you can see where my gums haven't been treated with the laser, that they're all square and they're all swollen. So this is 3 days later. I had my patient come back because she was making that comment. And I said, you know, Diane, how fast do your gums grow back? I'm humoring her because you and I know that it's the inflammation that we eliminated that created the tissue to look healthier and more anatomically correct. And so she says, oh, it only takes a couple days. And so I chuckled, but I said, how about coming back in 3 days and let me take a look? So she did. And by gosh, I know better, but I'm looking at this going, yeah, I think I am growing her gums back. And she says, see how my points are coming back? And then here where she has that filling, she said, which we've been telling her she needs to have an onlay. And she kept saying it doesn't hurt. But now that she saw the gums weren't coming back, she says, I'm going to schedule before I leave to get that onlay that I need because I want the gums to grow back. So I love how the patients see the results with laser. That's pretty exciting. So consistent therapeutic achievement is what we experience with laser, the consistency. Those of you that don't know my story, I am the walking, longitudinal study with lasers because I was practicing for 20 years before I ever picked up a laser because we didn't have them. So I know I did everything possible to stop the bleeding. When I got a hold of a laser, now I've been using one for 26 years. I am the study. I can tell you that the very first patient, I got changes in her mouth immediately, and I was onto something. So patient acceptance plays into therapeutic achievement as well. And so these are we can expect regenerative properties because of the release of human growth factor. We all know if we go back to our physiology, what's occurring with that. It's an anti-inflammatory effect, and it's pain control because the patients don't feel any discomfort using a laser. So this is what it looks like for those of you that aren't aware of putting a laser up underneath the gum tissue. You can see that there's a red light. The red light is only a guiding light. It's just an aiming beam that allows us theoretically to see where the energy is traveling. The laser energy that we use on these diodes is invisible. I love this picture because what you can see here is on the left, upper left, that patient, I've treated her 2 weeks ago. This is 2 weeks of healing. And then look at the difference in her inflammation where I'm treating her right side today. And look at the difference. So what I found with lasers immediately, and what you'll find as well, is the patients show the patients that it's working. And they'll come back and say, you know what you're doing now is working because I can see it. My gums look totally different. I found that my patients didn't miss any appointments once I started using lasers because they saw the value and benefit immediately. So we want to talk about conclusion. So let's make sure that we address untreated periodontitis in patients that have been underdiagnosed. I'm going to say something, and you remember I'm a hygienist as well. But statistically, the Centers for Disease Control knows that 47 to 49% of our patients that are in our chairs are underdiagnosed, that they have existing periodontal infection, but because we see them so frequently, we're kind of trying to keep ahead of it, but we're not theoretically stopping the infection. So let's remember that at this stage of what's happening with COVID, our patients' health is going downhill, that we're going to see more untreated periodontal infection, and that we need to diagnose them, get them treated, and also our patients that have declined therapy in the past. My conversation is going to be that the last thing we want is for you to have inflammation in any part of your body, because it puts you at risk for being victimized by other things that could really make you sick. So, and once then treated, let's reduce the risk for disease activity in our patients during periodontal maintenance by doing exactly what I said, using your laser in risk management recall, using your laser in healthy patients, and making sure that we're staying ahead of their potential to get new infection. So the possibility that untreated periodontitis may have a negative impact on the immune system or exacerbate complications of a viral influenza conveys to oral healthcare providers a critical responsibility. This is emotional. I think it's emotional for all of us, because our work has never been more important, because this COVID has neutralized the playing field worldwide, that every single one of us have a risk of this horrible disease that comes from this virus. And so all of us need to be recognizing that we need to stay as healthy as possible. And guess what? We already have been talking about it for years with our patients, that their mouth affects the rest of their body. So get ready. We've got a lot of people to treat, and it is our responsibility. And once again, we want to look in the mirror. I always say this in my classes, that before you go to work, you need to look in the mirror and you need to say to yourself, I'm going to work today and I have a responsibility for towards someone's longevity. How many professions can say that? And that's something we should have been saying all along, but now even more so. And so we want to realize that we are the experts. And I don't mean that. Those of you that know me, I'm not arrogant. I'm not saying that we're the experts for arrogant reasons. I'm saying that we're the experts in our field, and that's why our patients trust and look up to us. So we want to be recognizing the supportive role of advanced laser technology, implementing comprehensive treatment standards. We've got to spend our time, take the time to evaluate our patients and embrace these professional challenges that will not only secure the hygienist's own future and reduce our professional liabilities, but ensure that the ever-expanding public respect for dentistry as an essential provider in healthcare. And so I think that it's been very interesting, because the statistics are showing that the patients are coming to the dental practice because we've conditioned them, and they believe and trust that we've been treating them and trying to keep them healthy as best we can through recall, and that they know that they've missed their recalls and they're concerned about it. I bet your phones are ringing off the wall with your friends, like mine are calling me and saying, it's been 8 months since I've had my teeth cleaned. What do you think? Is it really bad? I go, no, you need to get over to your dental office. We're seeing patients every day now, so go for it. So here we have the next slide, is that my wish for you for giving me your time today is that you stay healthy. And also we want to say God bless America. Today is, our Veterans Day. So those of you that have family members that are veterans, then thank them for their service. But anyone that you know or don't know, we want to be reminded about the service that our veterans and our military give us every day of their lives. So I'm going to go ahead and put this up here, that I am a dental board approved laser certification trainer. And my contact information is, there's my phone number, and that's my email. I do have a website, but I haven't recently posted any program dates because every time I post something, we have to cancel because of COVID. So, but I am doing programs. I live in Las Vegas and I have a classroom. So if you're interested in coming to get a few days R&R, then let me know and we'll have a class, okay? So I've got one coming up December 5th if you're interested, and I hope to hear from you. But certainly if you have questions, I know I went through a lot of information very quickly, but I hope it gave you the impression of the information you were looking for tonight. And so I think that I'll turn this back over to David. I think we're pretty much on time where he wanted us to be, and there's some questions I believe are coming in. So David, can you hear me?
I can, Janet. Thank you. And thank you for a wonderful and engaging presentation. I never fail to learn something when you speak. And that's saying something. Been around dentistry a long time, and to always learn something from a presenter, an expert clinician is a rewarding thing. So thank you for sharing that with us tonight.
You're
We do
welcome.
have
Thank
some
you.
questions, and then at the end of those questions, Janet, I'll just spend a minute going through some CE instructions.
Okay.
So I'll ask for your patience at that point. The first question is from Cheryl Burns, and Cheryl says, Janet, she has trouble fitting LBR in as another procedure in the appointment. Do you or others find that same thing, and do you have any advice for her?
Okay, my advice is we got to get rid of the old and move on to the new. So it's hard to do, but we have to realize that we can't keep adding things. I know that's what you're experiencing. You're trying to add things and there's no time for it. But in the first 15 minutes, you should know the status of your patient's health. You should know the status of their periodontal health. And if the patient has periodontal infection, then you have time to bring them back for further treatment and more treatment. Okay, so keep that in mind as well. But we have to, we've been graded on the way we go through different procedures in our 1 hour appointments, and we've got a lot of changes happening. So we've got to get rid of some of the things that talking about oral hygiene for 20 minutes when a patient has an active infection doesn't serve you. So be minded that your objective is to heal the patient. That's the new standard with the new classification system. You're be held accountable to that. So don't shortchange what you need to do to treat people. But I think a lot of times, because people come in on recalls, what do? We spend more time trying to treat new infection in a recall appointment where we should stop and say, you know what, you have new infection. I need to get you back for therapeutic treatments to do the Ssrps, even if they had them a year ago or 2 years ago or 5 or 10 years ago. Okay, I hope that I answered your question.
Sure. I think you did a nice job, and I'm going to give some links and some resources at the end if people want to do a deeper dive beyond contacting you directly. Jen's been a member of a panel with us. We have some other content from Valerie Dangler and some of other hygienists using diodes, and I think that'd be helpful as well.
I do too. Thank you.
This is really timely, Janet, because of this whole notion about aerosolization and potential, safety concerns due to that. Deborah Viger, I believe Viger, would like to know if laser creates an aerosol.
The only time that you would get an aerosol would be if you there's a technique to using your laser. So when you put the laser in the sulcus, you want to place it below the crest of the tissue before you ever turn it on. Okay, that's the key to success. So you put it in the sulcus, and then you actually go into motion or action. You're moving it back and forth, and then you engage the foot pedal. The foot pedal then, while you're in motion, subgingival, it releases the energy, okay? So you're already in position. And then we talked about the dosimetry, how long you're gonna be staying in that sulcus. And then what happens, say you're gonna be treating for like 5 real seconds. So it's a count to 15. Then what would happen is you would be moving the laser the whole time back and forth in the sulcus. And then when you're finished with the dosimetry, how much time you're gonna spend, you would disengage your foot from the pedal, and that turns off the laser before you exit the sulcus. Okay, so back to your question. The only time you would get a plume or you would get smoke would be, or something that would aerosolize, would be if you don't get your foot off that pedal before you exit the sulcus and you have debris on the end of the fiber optic. Because remember, we're working in the sulcus where it's a non-oxygenated space. So there's no potential for any aerosolization or smoke to occur, okay, in the droplets, or to grab onto droplets. But what's going to happen if you've got your foot on that pedal? So it's technique, and it only takes a little bit of practice to be counting in your mind to get your foot off that pedal before you exit the sulcus.
That's great, Janet. Thank you. Excellent information. I'm going to pick up the pace here a little bit so we can sneak in as you're answering questions. More are coming in, so I'll try and do the best I can here. It's from Donna Wu. Is there a period of time you need to wait between Ssrp therapy and LAPT?
No, you don't. I think, well, you could, well, let's think about COVID. Right now, what do we want to do with the cost of PPE? I think I want to get my patient, I can get him in the chair, and I could probably, if I had 4 quadrants of Ssrp, if they just stayed for long, I scheduled a long appointment and they agreed to pay for it and as a down payment on the time, people are, they don't want to be coming in and out of dental offices or being in and out of their homes either. So I think that kind of solves some of that problem. But I think you should say that we really find that most patients can't come back usually more than once a week or once every 2 weeks. 2 weeks seems to be the length of time that people will come back to do a second round of treatment. So pay attention to that detail. Okay.
Sure. And this is from Anastasia. Are you using any topical prior to LAPT or LBR?
Yes, you certainly can. And I'm going to say this to you guys. I started giving injections in 1972. Oh my gosh. It was
You
a
were only
pilot.
5 years old.
Yeah, exactly. It was a pilot for the American Dental Association to see if anesthetic education was going to be viable for dental hygienists. And there were 3 universities that were selected to train us. So fast forward, I'm somebody that's been getting injections for a long time. But guess what? Because of laser having depolarizing proprioceptive nerves, it has an analgesic effect. What we are using is the expressible anesthetics, and the Cetacane by the Cedolite company. Oh my gosh, it's a 6-second uptake and it lasts for an hour. And so you express, and Ultradent makes this similar product with their little microcapillary syringes and stuff. So you express it sub-G. So we're using the benzocaines, but remember your pharmacology. Benzocaine has toxicity, so pay attention to the dosage. Okay, but yeah, it's a great way to get away from injectables, which by the way, no matter how good you are at them, patients don't like it.
Yeah, it's great. I think we can sneak in 1 or 2 more. And then there was a question about your workshop, which I'll save to the very end. Okay. This from Darley was about coding. And she wanted to know can they use 43, 46, and 49.99 together or concurrently or separate? Do you have to use them separately in your opinion?
You use them, you use them together, okay? And so the 4346 is the Gingivitis Therapy code. And if you look, that's for gingivitis. It's the new code, came out in 2016. And what you'll find is that code is, you can keep using it because we now know that gingivitis is the gateway to periodontitis. So what they're saying is that they're not going to limit us on how many times. So it's not a quadrant code. So you could do a full mouth gingivitis therapy on a patient, and then you could have them back, 6 weeks, 3 months later. And if they're still inflamed and bleeding, you could use the code again. But the 4999 code just delineates that you're using a laser. It's not a laser code, it's a non-specific perio code. And so it's based on description. So your administrators know that that 4999 code would be used to show that you used the laser during their 4346 gingivitis therapy, okay? And so it's not specific to laser, it's just simply a code that you use for using something or doing something additional in a perio therapy course program, okay?
Excellent. Thank you so much, Janet.